Hi, it's Orit here. Can you believe it's almost 2019? I am shocked by how quickly this year has gone, and the closer I get to the end of the year, the more obvious it is to me that I need to seriously rest and rejuvenate, repair, and just take some space. So, I guess I just wanted to inspire you to do the same if it's possible. Take some space away from whatever you're working on, because the more space we have, the more we can get back into our creativity and get back into that flow and just be refreshed for the things that we want to complete in 2019. And my word of 2019 is ease. And I am going to strive to feel easier and make things easier, even when they're hard. And just, that has to do with acceptance and self-love and all that good stuff. And I'm really tired of feeling that things are hard or that they have to be hard. So I also want to inspire you to choose a word for 2019. This has nothing to do with today's podcast, but today's podcast is pretty inspiring because we talk about end of life care. And one of the things that Molly Arney says is just how much this work helps her appreciate the life that she lives today. And, when you work with people who are dying all the time, it definitely puts a different perspective on the life that you're living. So maybe in some way it is related to today's episode, and just assessing, how we can really nurture ourselves and put some intention into 2019. So I wish you a very relaxed, joyful, and if not joyful, just a end of 2019 where you take care of yourself and just get in what you need. So here's the last episode of 2018. I hope you enjoy. This is Mind Your Body, a dance movement therapy perspective on the integration of our emotional, cognitive, physical, and spiritual aspects of our being into one more aware and whole existence. Welcome to Molly Arney for coming onto the podcast. It's great to have you here. And I would love it if you could introduce yourself, a little bit about you and what it is that you do and what you'll be talking about today.
Yeah, absolutely. I'm so excited to be you and being here tonight. I work as a dance movement therapist in end-of-life care and grief and loss. And we're going to kind of be talking about the use of movement, nonverbal expression, and breath in end-of-life care and grief and loss. I think that's it, right?
Yeah, we'll get into it more. So who is your population?
I work in hospice, full time, and I also have my own private practice, energy, dance, healing, and wellness. And I go into assisted livings, and nursing homes and work with the end-of-life care and memory care population. So I do both specific dance movement therapy groups on one lens, and then I do more individualized and small groups with families and the patient.
So you're working directly with the patient and their families to assist with end-of-life care?
Yeah.
Gotcha.
Mm-hmm.
Great. So can you tell us, what is it like to work with both sides? What are the main emotions and struggles that come up that you're helping them through?
Yeah. People always say, I can't believe you work in hospice. It must be so hard. And it is. And there are a lot of days that it's very hard, and I have to kind of come home and self-care the best I can. But when you flip kind of the lens of it's so sad to I feel so honored to be part of these individuals' lives. When we hear their stories, we can do life review and legacy and see where they've come from, what their lives look like, and being able to help them through their life into the end of life and supporting the family at the same time.
Yeah. I mean, that's definitely a totally different way of looking at the work that you're doing. And it does like feel
Mhm.
very lucky, you know, that they can have that in your support.
Yeah, yeah, exactly. And even sometimes it's harder to be with families because you're watching them grieve and you're watching them process what's happening to a loved one. But really, the beauty of utilizing dance therapy or just nonverbal expression is being able to really visually see what they're going through, and looking at their body and their breath and their tension, and being able to work with them on a different level than let's just sit and talk about it. And a lot of families like, oh, I don't want to talk about this anymore. I can't talk to another person. And it's great to say, okay, let's not, and let's come at it a different way.
Yeah, that is so great because it's like, I don't know, it just feels like, what is there left to talk about?
Mhm.
So, can you tell us more about the expression that you're facilitating through movement and breath?
Yeah, so specifically with the patient, it sometimes people might say, oh, it's easier when they're more learn oriented. Their illness progression hasn't come to a point in which they're nonverbal or non-responsive. But I actually think it's more interesting to witness a patient and their family when we're working through nonverbal expression, when they're non-responsive, when we're doing breath work, or we're watching their eye movements or their slight touches. I had a family that I was present for, and I brought my guitar too, so we could do live music and movement. And I just watched the patient's spouse just touch every part of her body when she moved. And he would touch that part, and she would breathe into it, and then move another part of her body, and he would touch that part. And we just kind of created this great space without any words. and everyone in the room just started crying because it was so beautiful to share that space. And it was almost like we didn't have to explain it or prep what, this is what we're going to do today. It was just this nonverbal organic expression for the spouse and their loved one of 50 years, where he just knew how to be present without having to say anything.
Wait, so can you say that again? I might have missed that. Who was touching what, and how did that happen?
So we had one of our patients in the hospice was in bed, and she was nonverbal and minimally responsive, and she would move. It would come off as agitated, like a slight grimace or a move of her arm, or she would move her knee or her foot. And her husband was sitting next to her, and every time she moved a specific body part, he would just gently place his hand on her, and you could watch her breathe into his touch, and that just continued for about 20 minutes. And everyone just watched this beautiful relationship of them just being able to feel and heal through energy and space. And it was just, for me, this wonderful thing to witness. And I'm sitting on the other side of the bed with my guitar, trying not to cry. It's like just so beautiful to watch it and to be there and share that space with them.
Yeah. So this is part of the nonverbal expression that you even see happening between your patients and their families.
Yeah, exactly. And for some reason, in my experience, and just, in different literature and such, that families in specific, are nervous, or they tend to not want to touch someone when they're dying. And that could be dying in the retrospective. They just came on the hospice and they have 6 months or more, or active or imminent death where they're declining. It could be days or several hours left of their life. And they're so scared to touch their loved one. And I've asked, I said, why are you so nervous to touch mom? And it's like, I don't want to cause her pain, or I don't know if she would want that, or I don't. And it's really being able to guide the family member, that friend, and saying, it's okay, maybe we can touch gently, or, I always guide a family member to put their hand under their loved one's hand, so they're kind of lifting them in a support. And it's just, you can watch the family and the patient just drop into that touch. And it's so interesting because we have this norm of like, they're sick and dying, don't touch them. Right. And when we can almost get over that hump, it's really beautiful to witness.
Yeah, that sounds amazing. And like, what a difference in perspective again, like it feels like just kind of shifting the paradigm or the belief system with the work that you do. The question that came to me was, how do you know how to facilitate that? Like, how do you know if your patient isn't going to get agitated, or if it's the right time or the right place to have that expression or that exchange?
Right. And I think it's like any clinician, dance therapist, psychotherapist, you go in with a little bit of history and you kind of slowly build that rapport, where I wouldn't meet a patient and their family on day one and say, okay, let's, jump in and it's okay to touch and let's create a space. And everyone would say, oh my God, dance, go away, So I would definitely meet the family, talk to them about the patient's life and history, see what they're comfortable with. If I find out that mom was never sure, she never liked to be touched or hugged, or she always, then I might do something where we just sit in that calm presence, or maybe we create a circle around mom and the bed, and the family and I would hold hands, or whatnot. Because I know going in that she was never a toucher, and that would be something that would probably agitate her. So really getting that kind of family and patient-free, learning about them, knowing their favorite kind of music or scents and aromatherapy, and kind of creating this space that's already comfortable and inviting. So if I push and say, let's try something new, then it's not going to be this kind of big shift. Of course, I think we can never know if someone's nonverbal and non-responsive. If I try something and they're agitated, okay, we won't do it again, and we'll try something different. But I always kind of go into a session planned to emptiness as much as we can, to go in with a structure and some knowledge, and then just let, things happen organically.
Yeah, definitely. What are some of the other interventions that you use? Like you were talking before about the therapeutic touch and the effects of calm presence. Can you talk more about that?
Yeah. I work with a lot of our volunteers, and the feedback I always get, I look and see who they're sitting with and what's going on, and how did their day go, and it tends to see all the people go to the verbal, alert and oriented, adorable 96-year-old grandmother who wants to tell you about her life, which is, it's easier to go into the adorable 96-year-old grandmother's room who wants to tell you about her life and all the wonderful things, which is great and part of legacy work and doula work. But going into those rooms with a patient who's nonverbal, non-responsive, maybe they don't have any family left, or they don't live locally, and being able to provide this calm presence, this quiet, energetic essence, if you will. You go into this room and you're just bearing witness. And, we talk about a lot of that in dance therapists and authentic movement, and just being a witness to someone else. And they don't have to be telling you their life story and the 96 years of this and that, and for you to bear witness and to just be this calm presence next to someone who is lying there and going through their end of life journey, really is just as important. And being in that space and giving them that space and that energy, being able to, like I said, putting, light touch, or putting your hand or their hand as a support, breathing with them, mirroring their breath. So if their breath is very deep, trying to breathe with them and having that entrained breath, you watch this this individual calm down if they're agitated, or I've seen, patients almost like drop their shoulders, like if we were doing a deep breath, and they could say, oh, they're nonverbal, they're non-responsive, but you go in and you sit calm presence and you give light touch and maybe just a gentle massage in their fingers, and you can really see the body just drop and just relax. And it's just as important as, going in and chatting with a 96-year-old woman as it is to just be present.
Yeah, that's so powerful. Like just to be the witness there and to see them at this time of their life and be with them instead of, kind of like you were saying before, maybe there's more fear and avoidance around that, but for you to go in and just be with, that's powerful.
Mm-hmm.
What about some of the stuff that you do around vibration and sound?
Right. So my undergrad is in music therapy, so I do a lot of live music with my movement sessions, and so I use a singing bowl, and I use my Shruti box where it's just tones and just vibrational sound. And a lot of times when I'll hold the instrument over a patient's body, if they're alert and oriented and willing, I'll ask if they want me to place it on their body. Some people do, some people don't. But you can feel the vibration of the sound internally. And when you feel the vibration, it resonates different parts of your body. And we can go into Reiki and chakras and all that jazz. But just a general drone sound gives this kind of calming, grounding feeling. And so you go in, and the first time I do it with the family, it's like, oh goodness, because it can be loud and a little jarring. And even watching the families, once you kind of listen to it for a bit and you feel the resonance, I've seen families close their eyes. I watch patients, really relax their shoulders and their breath. Sometimes if it's very quick or they seem agitated, I can watch that reduce. And you're just using this tool of sound. It's not music. We're not reminiscing. We're not singing. It's just vibrational sound. And it's so powerful. And I always would think, what's that really going to do? I'm just going to make this one sound. No one's going to want to hear that. But it just gives this grounding feeling. And sometimes if we do have family in the room, I might lead a guided meditation and really have them, put their feet on the ground, sit down. A lot of times families are so nervous, they're pacing and they're standing and they're walking, and just saying, okay, let's drop in, let's sit, let's reground, and I'll bring in that vibrational tone. And you can just see the families and the caregivers just really drop into that. And then that helps them be more present for their loved one too.
Yeah, it sounds like you're facilitating this calm presence for the patient from the family too, instead of I can just picture it like the pacing and the standing and the huffing and puffing and that it's so stressful, but to create that environment, that sounds so important too for their family member to experience, their family being there for them in this grounded, centered, present way.
Mm-hmm.
That's awesome. So you were talking about life review, and can you explain, what legacy and life review is and how you use dance and movement through that?
Yeah. So, life review can just be as basic as really sitting with a patient and saying, okay, tell me about yourself. And you kind of start there and you reminisce through the years, and they can have that space and that opportunity to really go through their life, which not everyone gets, especially at the end of life. If it's a traumatic loss or if it's sudden death or what have you, not everybody gets that ability to really say, let me look at my life. So, kind of starting with that verbally or journaling. I love utilizing storytelling and then putting it into movement. So can we almost choreograph your life. Like what would that look like in your body, or what would that look like in movement? And we always joke, I'm from Jersey, and so everyone's always using their hands, and so it's always like people try to explain things, and all they do is use their hands. So it's that always kind of ends up being part of the movement in their life review. And so with legacy work, it's a little deeper. And I remember, I completed my thanatology certification from the Open Center in New York, and we did our first, training on legacy work. And I said, oh my God, how heavy, like, what's your legacy? Like, what are you leaving behind? And so that's such a heavy topic. Everyone's supposed to leave this amazing legacy. And what do I do with that? I have nothing. I'm X age. I've done what, and it almost gives this opposite reflection of, well, what did I do? And again, you kind of go back to that change in perspective, and it's not like, oh, I've left this life legacy. It's, what do I want to be remembered? Like, what did I do in my life? Was I a good person? Do I have children? Did I do X, Y, and Z that made other people happier, that made me happier? What do you want to be remembered for? And when you shift it that way, again, people say, oh, well, no, I guess, I want to be remembered for always being kind, or, we have a lot of families that love, especially the older generation, they always did Christmas at their house, or they always had Hanukkah at their house, and so I just always want everyone to remember how wonderful Christmas Day was at my house, and that's their life legacy. And it can be so simple, but it doesn't matter how big or small it is, because it's your life legacy, and kind of taking that and then saying, okay, the same thing, how can we put it into our bodies, or how can we move through this in space? And sometimes people are like, well, there she goes again with that dance business, but like, if I say, well, let's breathe through it, or let's move through it, sometimes it can be, again, a real journey through movement, or we can just breathe through difficult times, and we can smile and remember all the little movements, smiling and having bright eyes and relaxed shoulders, and kind of going back into our bodies and presenting who they are and who they were, and how they want to be remembered. And sometimes when you can help someone feel that in their body, then their family sees it, and there it is. Like, there's their legacy. And, it's not wildly simple, but it's not like wildly over where we can't think of it or get it ingrained into our bodies. But it's just taking that step by step and having someone being willing to move through their journey with you.
Yeah. So does that usually look like a choreographed dance, or like that they revisit, or is it just more spontaneous in the moment?
In my experience, it tends to be more spontaneous. When I do my groups, it ends up being a little more choreographed, because they might be more alert and oriented, and will have the ability to give direction or say, this is what I want. But with end of life, and especially, active and the patient and the families, it's more spontaneous. And a lot of times I'll come in with a little humor, and we always say you have to have humor in hospice, because you're not going to make it, as a professional, because you have to see the life and you see the journey and the happiness, or it just becomes too sad. And so when we do it spontaneously, I'll kind of go in and be like, all right, let's dance, and do something silly. Or I'm known for I always shoulder shimmy. It's kind of like my go-to move. And without fail, I always get a laugh. And so it must look ridiculous, because always gets a laugh. And they'll be like, oh, Molly. And that'll break barrier of like, oh, I don't want to get my body in. Oh, I don't want to dance. And so I'll just kind of move, and they'll move, and then I'll mirror them, and we'll kind of share that space together, versus, me telling them to do something, or them saying, okay, this is what I want, and just being able to journey together organically.
Yeah. And so, like, are there times where you reflect back in words what they're doing, and then Like, are they able to connect that to their legacy or their life review?
Sometimes, like I said before, I think it's, I always feel so honored as the witness because depending where they are in their, their illness trajectory, they might not have the ability or the awareness to reflect back or to say, yes, this is, that's what I was thinking and that's what came out of my body, and allowing us to just mirror each other and, well, more so me mirroring the patient and them, responding, and then me bearing witness to their legacy or their life review, because we might have gone over something prior and talked about it, and then I watched that occur. And not always will they have the ability to say, yes, I see how that happened. But the families do.
Okay.
And again, that's that space.
Right. Yeah. So when I'm guessing you witness like the entire process, like the actual end of life for your patient, and then you work with the families to help them through the grief.
Mm-hmm.
Yeah. So what does that look like? Like, how do you incorporate movement into the grief relief?
So I've been recently trying to push a little harder and seeing where I can get. But, it depends how recent the loss is. It depends if someone might come in for group and I didn't know their loved one, because we'll have a group that might not be a family member that we particularly worked with. And so, kind of knowing where they are and what their story is, how recent their loss was, will I dive into movement? Because with grief and loss, there's no plan, and we always say, Kubler-Ross 5 stages, and there's structures and zones and a lot of different theories and things that work for a lot of people. But there's just no right or wrong way to grieve. There's healthy grief, as they say, but everyone's on a different plan, and we always say that you never recover from grief. You're never going to heal fully, and it's a lifelong journey to process. And so I never really dive into movement like the first time I meet someone or they had a recent loss. We'll sit with the space and see if anybody talks. I'll do a lot of regrounding. So I'll do almost like, I call it like secret dance therapy. So I will say, let's reground, let's deep breath, look at each other in the group. Can we make eye contact? And not coming in and saying, this is a dance group and this is a movement group. And, kind of start very light and easy breezy. So they feel comfortable and they kind of take it one step at a time, because with grief and loss, you're flooded. And so being able to say, okay, this was just a little piece and now I can talk about it. And this was just a little piece and now I can talk about it. I know that can be in the beginning of a group, where I've run groups where it's, people who have had grief or are interested in grief and loss, or, different things, where I'll dive right in and we'll talk about empowerment, getting in your body, and we'll do superhero poses and really be very body based. So it's kind of a beginning and an end of a process, as far as bringing the movement in.
Yeah. So the groups are with you for a certain number of weeks, where this is kind of the progression that you go through?
Right. So the groups are, I think, 8 weeks long. And so, but everyone kind of comes in on a different part of their grief journey. Right. So it's really being able to kind of tap in and see where everyone can move. Because if you have someone that's very resistant, you don't want to push and then they won't move at all, and not even physically move, but just move through their own process. So, there's like that aspect of, a 6-week group or 10-week group, and then other people that are not a group of people and they might just come to workshops or specific, self-care classes or things like that, where we'll just go over, utilizing interventions and self-care tools and creating their toolbox and going through things where they can have a less abstract look at their grief and say, okay, I'm going to go home and I'm going to do yoga, or I'm going to go home and I'm going to take 5 deep breaths, and be able to give people very concrete body-based tools.
Yeah. And I just imagine overall the group aspect is important, to be in an atmosphere that feels safe among other people who kind of sort of are on the same path of grief. And like, as a dance therapist, I know as a dance therapist who runs groups, like, that's just so powerful to just have that connection with people who are going through the same thing or similar things. Like, sometimes even more important than the actual movement that you do is just like that sacred space.
Right, exactly. And sometimes people even say, oh, I feel better, but I don't know why. And it's like, and it was just, holding that space. And as a clinician, sometimes it can be very hard. But when the other group members are willing to hold the space together, like you said, it really kind of gives this safe, collaborative energy, where people just say, I can do this alone.
Yeah. Yeah. So, last question, what kind of lesson do you take from this kind of work? 'Cause this is big stuff, I don't know if I could do it, but I imagine like there's just so much, value in what you learn about yourself in your own life. Would you mind sharing something?
Yeah, it is big work and hard. But being with the dying, it gives you this look at your own life and kind of the ability to reflect and what is my legacy? What has my life been? How do I want to lead it? How am I leading it? And what am I doing for myself? What am I doing for my family and friends? And if I were in, this patient's position, what would I want? And a lot of, it's a very hard thing to talk about. And it's not the cultural norm to say, this is what I want when I die, or, this is how I want to live my life. So my, funeral will be X, Y, and Z. And it's like, oh, I don't want to talk about that. It's upsetting or it's scary. And it's so important to embrace that topic and say, this is what I want. And this is how I want to live my life. Because then we lose this chunk of fear that we have instilled of us on death and dying. And a lot of it might not necessarily be about the death or the dying aspect, but how you lived your life up to that part. Yeah.
So important. I was just doing this planning workshop for 2019, and one of the exercises was, you're at a funeral and, blah, 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 blah. And basically, like, you look at the person and it's you. It's your funeral. And it was like, 3 years from now, how do you want to leave? What do you want your closest family member to say about you? What do you want your best friend to say about you? What do you want your colleague to say about you? And I just wrote out these 3 different speeches, and it was, it's so important, and it makes you realize this is how I am living in alignment with what I want to leave behind, and this is what's missing. So as hard as your work is, as big as it is, I can imagine how important and valuable that reminder is for you as well.
Yeah, absolutely.
Yeah. Thank you for that. I feel like that one's going to really, that little piece of advice is just super powerful. It's going to make people think, be like, oh, yeah. Yeah, I should think about that. Cool. Any last words? Is there a way for, if anyone's interested in finding you?
Yeah, I'm on everything, LinkedIn, Instagram, Facebook. Molly Arnie, just spelled the same typical way. And my company is Energy Dance Healing and Wellness. And I have a website and social media platforms for all that. And my contact information is on the website.
Awesome. Thank you so much. This has been
Thank
really
you.
great.